There's a question that haunts men's private search histories and keeps them awake at night, worried about their prostate health. What really happens to your prostate if you masturbate every single day? The internet is filled with terrifying warnings that it causes inflammation, damage, even cancer. But what I'm about to reveal from Harvard Medical School's groundbreaking research will shock you. The truth is the complete opposite of what you've been told, and it could literally save your life. Stay with me because you won't believe what the science actually shows. But first, let's understand what's really happening inside your body and why this matters so much for your long-term health. But let's be clear, this content is entirely focused on health and has no pornographic intent. Understanding your prostate gland, is about the size of a walnut and sits just below your bladder, surrounding the tube that carries urine out of your body. According to the American Urological Association, this small but mighty gland produces the fluid that nourishes and protects sperm. But here's what most men don't realize. As we age, the prostate becomes increasingly vulnerable to three major health threats. Benign prostatic hyperplasia, or BPH, affects over 50% of men in their 60s and up to 90% of men in their 70s and 80s, according to the National Institute on Aging. This causes the prostate to enlarge, leading to those frustrating bathroom trips in the middle of the night. What makes this particularly concerning is that prostate cancer is the second most common cancer in American men, with the American Cancer Society reporting that about 1 in 8 men will be diagnosed with prostate cancer during their lifetime. These statistics create understandable anxiety, which is why so many myths and misconceptions have flourished around activities that might affect prostate health. For decades, masturbation has been surrounded by fear-based claims, suggesting it could lead to prostate inflammation, increased infection risk, or even contribute to cancer development. These fears have caused countless men to worry unnecessarily about a completely natural behavior. You might be wondering how something so simple could have such a profound impact on prostate health. Scientists have developed several compelling theories based on cellular and physiological research. Researchers at Harvard T.H. Chan School of Public Health published findings that sent shockwaves through the medical community. Dr. Jennifer Ryder and her team had been following 31,925 men since 1992, tracking their health outcomes for 18 years. This wasn't some small survey. This was one of the largest and most comprehensive studies of its kind ever conducted. What they discovered completely contradicted decades of fear-mongering. Men who ejaculated 21 or more times per month had a 20% lower risk of prostate cancer compared to men who ejaculated only 4 to 7 times per month. Let me repeat that, because it's so important. More frequent ejaculation was associated with significantly lower cancer risk, not higher. But the Harvard study wasn't alone. Dr. Grimoles from Cancer Council Victoria in Australia conducted a similar study with over 2,000 men and found nearly identical results. Men with higher ejaculation frequency showed a 36% reduction in prostate cancer risk before age 70. The Mayo Clinic's research department has also weighed in, stating that the protective mechanism likely involves several factors. First, regular ejaculation helps clear the prostate ducts of potentially harmful substances. Second, it may promote healthier cellular turnover, encouraging the replacement of old, potentially damaged cells with new healthy ones. Third, the stress relief associated with sexual activity may reduce overall inflammation in the body. The science behind longevity and cancer prevention is fascinating, but I know many of you are dealing with uncomfortable symptoms right now. That's why I want to share something special, a powerful secret for natural anti-aging. Scan the QR code on your screen to get your free ebook instantly, or grab the link in the pinned comment below. Now I know what you're thinking. If this is protective, how often should I be doing this? The answer isn't one size fits all, and it definitely changes as we age. For men in their 40s, the optimal frequency appears to be 3 to 4 times per week. At this age, testosterone levels are still robust, and the prostate tissue recovers efficiently between sessions. Men aged 50 to 59 should consider reducing frequency to 2 to 3 times per week. For men 60 and older, which likely includes many of you watching this video, the recommendation shifts to 1 to 2 times per week. However, if you're experiencing any symptoms like painful urination, blood in urine or semen, persistent pelvic pain, or significant changes in urinary patterns, you should consult with a urologist immediately. These could be signs of underlying conditions that require professional evaluation, regardless of your ejaculation frequency. The Cleveland Clinic adds that men taking certain medications, particularly alpha blockers for blood pressure or enlarged prostate, should discuss optimal frequency with their healthcare provider, as these medications can affect sexual function and recovery time. It's crucial to listen to your body's signals. If you experience fatigue, difficulty with urination, or any discomfort following ejaculation, these may be signs to reduce frequency and consult with your healthcare provider. While the research on ejaculation frequency is compelling, it's crucial to understand that this is just one piece of a much larger puzzle. Prostate health requires a comprehensive approach that includes diet, exercise, stress management, and regular medical monitoring. Let's start with nutrition, because what you eat directly impacts your prostate health. The Prostate Cancer Foundation recommends a diet rich in lycopene, stress management, and regular medical monitoring. Let's start with nutrition, because what you eat directly impacts your prostate health. The Prostate Cancer Foundation recommends a diet. Polyphenols in green tea, particularly EGCG, can help slow prostate cancer cell growth and reduce inflammation. If you drink 3 to 4 cups of green tea daily, but it should be consumed between meals to avoid iron absorption interference. If you're diabetic and concerned about the natural sugars in watermelon and grapefruit, focus on cooked tomatoes and tomato paste instead. A half cup of tomato paste provides the same lycopene as 2 whole pink grapefruits, but with minimal sugar impact. Men with diabetes can still achieve the protective benefits through concentrated tomato products. For those with kidney disease who must limit potassium, many lycopene-rich foods are off-limits. You should be working with a renal dietitian to find modified sources. Tomato sauce made from peeled tomatoes has lower potassium, and lycopene supplements may be appropriate under medical supervision. Omega-3 fatty acids are another crucial component. The best sources include wild-caught salmon, sardines, mackerel, and high-quality fish oil supplements. Aim for at least 1,000 milligrams of combined EPA and DHA daily. Even more encouraging, men who increased their physical activity after diagnosis showed better outcomes than those who remained sedentary. At least 150 minutes of moderate intensity exercise per week. This doesn't mean you need to run marathons. Brisk walking, swimming, cycling, or even vigorous gardening can provide significant benefits. Weight management deserves special attention. The American Cancer Society reports that obese men have a higher risk of developing aggressive, life-threatening forms of prostate cancer. Sleep quality also impacts prostate health in ways most men never consider. Aim for 7 to 8 hours of quality sleep nightly. And if you're waking frequently to urinate, discuss this with your doctor, as it could indicate BPH or other treatable conditions. Before we wrap up, I need to address some crucial warnings that every man over 60 should know. While the research on ejaculation frequency is encouraging, it's absolutely not a magic bullet or a substitute for proper medical care. If you're experiencing any of these symptoms, you need to see a urologist immediately, regardless of your ejaculation habits. These include difficulty starting urination, weak urine flow, frequent urination, especially at night, blood in urine or semen, persistent pelvic or back pain, or painful ejaculation. Family history matters enormously. If your father or brother had prostate cancer, your risk doubles, according to the American Cancer Society. African American men also face higher risks and should begin screening earlier. That high-risk men begin PSA screening at age 40, not 50. The PSA blood test, while not perfect, remains our best screening tool. The key is working with a knowledgeable urologist who can interpret results in context with your age, symptoms, and other risk factors. While the studies strongly suggest a protective effect from frequent ejaculation, we can't say definitively that it prevents cancer. There may be other lifestyle factors in men with higher ejaculation frequency that contribute to their lower cancer rates. So let's circle back to our original shocking question. What does daily masturbation really do to your prostate? The answer, supported by Harvard's groundbreaking research involving over 32,000 men, is the complete opposite of what fearmongers have claimed for decades. Far from being harmful, frequent ejaculation appears to offer significant protection against prostate cancer, with men ejaculating 21 or more times per month, showing up to 20% lower cancer risk. The mechanism likely involves flushing out potential carcinogens, promoting healthy cellular turnover, and reducing chronic inflammation. The Harvard study provides valuable insights, but optimal frequency should be determined by individual factors: your energy levels, relationship health, personal constitution, and overall quality of life, not just cancer prevention statistics. The goal should be overall wellness, not meeting a medical quota. Most importantly, never let this information replace regular medical checkups. Work with a qualified urologist for appropriate screening, especially if you have risk factors or concerning symptoms. The combination of healthy lifestyle habits, including appropriate ejaculation frequency, regular exercise, proper nutrition, and professional medical care, gives you the best chance of maintaining prostate health throughout your golden years. Make sure you're subscribed, and I want to hear from you in the comments. What other men's health myths have you heard that you want me to investigate with real science? Are you dealing with prostate symptoms that concern you? Share your experiences below. I read every comment and respond to as many as possible. Remember, knowledge is power, especially when it comes to your health. Stay curious, stay proactive, and I'll see you in the next.